Hello and welcome to Dialogue with Global Thinkers. I'm Xu Qinzhuo. The COVID outbreak has revealed deep fissures in the global pandemic response, most notably the stark absence of international cooperation. As a result, the response has been severely challenged over the past 2 years. More than 2 million people have lost their lives. So what has COVID-19 taught us, and what lessons can we learn? And how can the world be better prepared for the next pandemic? Today, I'm glad to be joined by global thinkers, scholars, practitioners, and policymakers to take a close look at the important topic. At the same time, we also have a strong presence of audience who will also weigh in on this topic. Let me take a look at our panel. We have Dr. Alice Tan, internist at MizMedi Women's Hospital. We have Dr. Andrea Feigl, the founder and the CEO of the Health Finance Institute, a former researcher at the Harvard Chan School of Public Health. And Wang Linfa, professor, Emerging Infectious Diseases Programme, Duke-NUS Medical School, Singapore. Dr. Dennis Carroll, president, Global Virome Project. And Donald Milton, professor, Institute of Applied Environment Health, School of Public Health, University of Maryland. And Dr. Zhiwei, Director, Center for Public Health Research, the Medical School of Nanjing University. Welcome to the discussion. I will start with Andrea. Andrea, if you can identify probably one factor as the most important single issue that has somehow prevented us from effectively dealing with this pandemic, what it would be?
So thank you so much for having me. And I think the one factor would be coordination, global coordination, and the speed of response. I think different approaches, tardiness to respond, and coordination on vaccine rollout is probably, and I'm sorry, these were three things, but these are the factors that I see as the elephants in the room in terms of how we experience the pandemic.
Mm-hmm. Well, the lack of coordination or poor coordination. Alice, what do you make of that?
Well, I agree. I would add to that I think communication really was a problem in terms of misinformation and poor communication, poor community engagement. And the reason why I say this is because even now, more than 2 years after the pandemic exploded onto the scene, we are still dealing with problems of vaccine hesitancy. Even though vaccines are developed, we know that they work, we know that they're safe, and the supply issues have been improved. There's so many people who still refuse to get vaccinated. And I think this really has hindered our approach to trying to get over this pandemic. And that's one of the reasons why we're still talking about it in the midst, this is not an issue in the rear view mirror yet.
Mm-hmm. Okay, Zhiwei, anything to add?
Well, as a research scientist, I think it's critical to exchange scientific information and to have the latest information on the pandemic. I think one of the issues here is that, as all the speakers mentioned, we lack international coordination and understanding. I think this, in a way, hinders the exchange of scientific information. That actually, by the way, also in a certain ways that affect the effective control of the diseases. I think this is a lesson that we learned over the 3 years.
Mm-hmm. Well, Dennis, I still remember when we dealt with the Ebola successfully. You see the Chinese scientists and American scientists working shoulder by shoulder in West Africa to successfully, containing that virus. What happened to us? Somehow we all failed, to prevent the spread of this virus.
Well, the Ebola epidemic in West Africa was really an ideal example of coordination and political leadership. So as you mentioned, I worked there, and we worked very closely with our Chinese colleagues who are actively, as well as our colleagues from France and Italy, from Uganda, from South Africa, So it was really the kind of example you really wanted to see applied to the COVID-19 experience. I think we would all agree that the failure had less to do with the virus than our own inability to really harness the full range of resources that we had to be able to bring this virus under control. So I think ultimately we need to be as efficient, as resilient, and as adaptive to this virus as the virus clearly has shown itself to be to us.
Mm-hmm. Well, Donald, anything to add? What is probably, if there's, we will redo this, anything, probably we can do better so as to respond effectively?
Yeah, I think the comparison with Ebola is an interesting and instructive one. One of the key differences between these two viruses is in their mode of transmission. The Ebola virus is primarily by touching other people, whereas the coronavirus is transmitted by sharing air, by rebreathing air that other people have been breathing, mostly in indoor environments. That makes this a much, much more difficult virus to control. And the medical community globally has not had a good appreciation of the mode of transmission until very, very late in the pandemic. And it still comes in as a very secondary concern. And another problem with respiratory viruses, such as the coronavirus and influenza virus, is that the vaccines that we have do not prevent transmission. And we've seen this now over and over again. And so while they can reduce severity, we remain having a part of the population that remains highly susceptible and becomes quite ill, even when you have very high rates of immunity in prior vaccination. We estimate that in the United States, there's now something like 93% of people have either been vaccinated or infected previously, but they are not protected against getting infected again, and a small fraction of them will have severe disease or long COVID. This makes this problem much more difficult than Ebola was on a global scale. And it requires a major shift in the scientific paradigm that drives the medical community about how transmission happens and what works. No one thing is going to work. It takes layers. It takes vaccination, it takes drugs, it takes ventilation, filtration, and air sanitation. And we need to be using all of these, and that idea needs to be out front, and it hasn't been. And that has been a fundamental vulnerability and why the world has not controlled this virus. And where we have been able to control it to some extent, it has been at a tremendous cost.
Mm-hmm. Linfa, I bet you probably agree with what Donald has said about the virus itself is probably a challenge unprecedented in the past decades also.
Yes, I think, being the last one, everybody has said and I agree with, but I think I have to add two new angles. Is to do with the political will, right? First is the lack of political will to take virus seriously. People like me have been predicting this for the last 2 decades. We had a SARS, we had Ebola, Zika, H5N1. I keep saying that this class of coronavirus after MERS, I think that if we had a SARS and MERS, we'll have another coronavirus. So I have been predicting this and I try to really, alert, but I think the international community and our political leaders did not take that seriously. So the lack of political will to work together and be ready was not there. Then after the outbreak, then the misplacement of the political focus, on the virus origin. I'm the person very passionate about virus origin studies, but, after the outbreak, that should not be focused. We should be focused on the origin of virus study to prevent the next pandemic, not the current one. So I think these are two, made the whole thing even more difficult.
Okay, Linfa, despite the lack of coordination and cooperation among nations, but we what we have seen is the scientists, researchers around the world, US, China, Singapore, European scientists, they have been working together without problems. Isn't that the case?
I think to a large degree, I was involved in SARS-1, so I was on the WHO commissions. I worked with scientists from USA. At that time, I was in Australia, so we have scientists from USA, Australia, France, Japan, Philippines, China. So that it's closer than this time. This time, I still, sit on many committees with the WHO and things like that. So the information exchange is good, but not as good as in 2003, but the material exchange certainly has hindered. The scientific collaboration, is not as severely impact as in other, political sort of level, but certainly not as good as 17, 18 years ago.
Okay, not as good as it could be, probably.
Yeah, during SARS-1 days, yeah.
Right. Well, Alice, earlier you mentioned about disinformation or conspiracy theories that has affected probably the wearing of the mask or the use of vaccination. How big is that issue globally? We of course read a lot of reports inside of the US. What about the rest of the world?
I think what happened in the Nordic countries is very informative. So if we look at what happened during the pandemic in Norway, Finland, Sweden, and Denmark, and we compare the outcomes, we can see what a huge role communication played. So in Sweden, there was actually a lot of misinformation to the public in terms of how careful people would need to be. They took a very laissez-faire approach in terms of the government trying to sort of protect Sweden's image. And they were not really forthcoming in terms of the epidemiological information. Whereas the other Nordic countries, they went into lockdown and they followed a lot of the same measures that European countries followed. In terms of the economic impact, when we look at how the 4 countries fared, actually, I think economists have done the research. They said the countries fared about the same, all in all. However, in terms of mortality and the health impacts, Sweden fared much worse compared to its neighboring countries. And so, it's difficult to compare countries when they're far apart and politically so different and economically different. But the Nordic countries, they have a lot of similarities. And so we can sort of take those countries as a test and control trial, so to speak, in terms of examining the role of communication, the role of government leadership, what happens when you do not inform the public in terms of what's going on and what the best evidence shows in terms of how they should protect themselves, what kind of non-pharmaceutical measures needed to have been taken early on before vaccines were available. That just did not happen in Sweden, and the people suffered as a result. The mortality rates are starkly different.
Donald, you want to jump in?
One of the things that I started out my academic career in occupational and environmental health. And one of the characteristics of the work in that field going back about 30 years has been that when we get big center grants to do research in those fields, one of the key components has been community engagement. And now that I work primarily funded by infectious disease research agencies, I've discovered that that isn't on their radar. I'm not required to have a communications and community engagement component of big center grants. And I think this is part of the failing, is that the infectious disease academic community hasn't figured out, and maybe we've learned this now, but hasn't really internalized the message that you can make it, but that doesn't mean people will take it. And that if we're going to be effective, communications research has to be involved from the beginning. So in research that I'm doing now, for example, on UV air disinfection, one of the first things that I'm doing is starting focus groups, trying to understand, involving communications experts and behavior experts to engage people in talking about what it is we're doing and how do they perceive it, how do they feel about it, what would get them to understand and engage and use it. You might think that sanitizing the air would be non-controversial, but I'll bet you it won't be. And that every aspect of what we do can be used by some opportunistic politician or somebody who just sells garbage on their website, but gets traffic to come sell fake health cures, will use conspiracy theories to drive their profits. And we've seen that even with gun violence here in the United States, where a jury just awarded millions of dollars to families that have been victimized by scammers who make their money off of selling health products on their website, and they drive people there with conspiracy theories. We are a very different communications environment than when I remember when the I'm old enough to remember when the oral polio vaccine came out, and people lined up at churches and community centers to get your little sugar cube with the vaccine on it. And there was none of this. I mean, everybody was scared to death their kid was going to be paralyzed and wanted this vaccine. We don't, even though people are dying of this virus, and people know people who died and they still don't want the vaccine, it's a very different information environment than we had 60 years ago.
Mm-hmm. Dennis, one impact probably from this outbreak, from this, let's say, failure to deal with the pandemic effectively is this, people would call it like a medical nationalism. Some national leaders draw this conclusion that, because of the difficulty to secure the supplies, we needed to have our supply chain inside our borders or in our neighboring countries, so that would be safe. But then, is that practical or is that wise? Given this kind of pandemic could be, say, once in 100 years or once in a generation, how can you be ready forever? Have a supply chain there, available any minute for the outbreak of any pandemic?
Well, obviously there are going to be some long-term ramifications from this pandemic, and the supply chain discussion is just one of those. There are arguments to be made, and we saw this quite clearly even with SARS in 2003, that there was an enormous disruption of supply chain as that virus swept across Asia. So I think this is not the first time we've seen supply chains disrupted by a disease, and it's not going to be the last time either. How we deal with that is a long-term solution. I would hope that it's not actions that we take because of narrow political agendas. They're actions that we take because they give us the best opportunity for being resilient and adaptive. That's ultimately what we need to be able to do, is to position ourselves to anticipate far better than we have what the disruptive effects of events like this, and how we can make sure we put in place the kind of systems and capacities that are adaptive and resilient. So it may be some hybrid moving from sort of the global supply chain dynamics that we've had over the last 2 decades to something that strengthens some aspects of national productive capability. But I think much more importantly, we need to be much more open and transparent on our trade and trade policies to maximize, the resources we have. Fundamentally, look, anything that is a global event requires a coordinated global response, whether we're talking about coordinating science, coordinating politics, or coordinating supplies. We need to be much more globally linked and connected towards that end.
Well, Andrea, a related question, according to the WHO, World Health Organization, almost 30% of countries have no COVID-19 national preparedness and response plans, and only half have a national infection prevention and control program. Obviously, there's an inequality in terms of the ability or capacity to deal with a pandemic at this scale.
I mean, these numbers show that both from a national level, countries need to invest in healthcare systems. There's a target of about 5% of GDP that countries should invest in their healthcare systems, and it includes that infrastructure. And only a subset of the least developed countries is going to reach that by 2040, only about 30 to 40%. So even if we have another international event in 2040 and 2050, we know, even in the best case scenarios, that there will be countries that will need international technical assistance. That is why, as part of the preparedness plan, it is so critical that we also have international monies and technical assistance and international bodies and strategies set aside and ready to jump in and support. So it has to really be a synergy of national and international preparedness and investment in preparedness. And we work a lot on preparedness, prevention finance, and it's so hard. I think maybe we need to communicate this better, but investing in prevention is gonna save us 10x the resources that will cost if we again wait and do nothing. And I think that needs to be communicated just as much as we need to communicate better on vaccine hesitancy and vaccine uptake.
Mm-hmm. Well, Zhiwei, speak of this, international coordination or lack of it. WHO is playing a critical role. At the beginning, it was criticized for lack of probably early warning system or respond effectively. But anyway, WHO is playing probably the role to coordinate, given what's going on, geopolitical differences, geopolitical competitions between big powers. Very difficult for them to come together and cooperate. So can we find other ways, or one way or the other, to strengthen the role of WHO?
Well, WHO has been doing a great job. Basically, when in the very beginning of the pandemic, it created a mechanism, the COVAX, trying to give certain incentives and get the country involved in this vaccine consortium to provide the vaccines to low-income countries. Although it has experienced tremendous difficulty in getting sufficient number of vaccines to be distributed, but still it does distribute quite a significant number of doses into the low-income countries. I think not only the vaccine is an issue, just as the previous speakers mentioned, that we need to do a lot of preparations for the pandemic, which requires tremendous amount of resources, personnel, expertise, and etc. So this is something I think in considering the future potential pandemic, I think it's critical that we do a preparation in the early stage by providing various different helps through the WHO's mechanism. I think this is something which the wealthy countries or developed countries could do in advance. I think this is critical that we do develop the mechanism of multiple government to deal with any future pandemic in the way how to distribute and how to train personnel and how to provide medical resources and materials. Those are it's quite essential issues we need to think very carefully. Vaccine is only one of the problems we are experiencing, which has a high profile attention.
Mm-hmm. Well, Dennis, speak of WHO, people would say it's deeply under-resourced. In 2018, people give this number. It had a budget of about 2.9 billion, or less than $3 billion US, similar in size to the budget of a large US hospital and less than a third of the US Coast Guard budget that year. Are we expecting more resources, probably donated or contributed from countries?
Well, it's clear that WHO has been under-resourced, but they've also been over-mandated. We're constantly expecting more from them than they have the resources to deliver. So I think we need to take a step back and really ask, what is the role we're asking WHO to play? And then making sure they have adequate resources to be able to do it. When you mentioned the budget that they do have, most of that money is what we would call earmarked. They have very little flexibility in how that money is used. They get money from contributing donors from countries and from foundations, but they come with very specific agendas attached to them. Their ability to draw on resources to be able to, one, do the adequate investments in preparedness that we're talking about, but also to have the flexibility to mount a surge response when there are events that begin to unfold. It's not just a question of money, their human resource capital is also underinvested in. So I think that there's some serious issues that we have to address about the role of WHO within the global health architecture and the resources we're making available. I might also say that we've seen over the last decade a growth in sort of global health bodies, which are no longer attached to or associated with the UN. CEPI, for instance, is an example. And those are examples of where there's been frustrations with WHO in terms of being able to bring the kind of adaptability, flexibility. And so there's investments in creating these parallel, in many ways, complementary efforts, but it still tends to undermine, I think, WHO's overall mandate. And we need to think much more thoughtfully about that.
Mm-hmm. Well, Linfa, also on WHO, do you expect, we have a lot of differences between countries, they have different agenda, probably priorities, but at least we can all agree upon this, that, the WHO should be strengthened. Their mandate should be probably also reinforced with, more investment and more contribution from member countries.
Yeah, that's for sure. I think, especially through COVID, there's a lot of opinions about WHO, what they should do, what they should not have done. At the same time, I think, at the present time, I don't think we can come up with an international body that will be more suitable than WHO. So we are kind of stuck there. On one hand, we think WHO is the best platform to respond to something like COVID. On the other hand, we found that their power and everything is under-resourced, economically, and it's just not adequate. So I think it's very complicated. I have worked as a consultant for WHO, so I'm a bit biased. Clearly that they are a facilitator and a coordinator. Now, if a facilitator and coordinator, the team members are all work towards the same goal, then it's easy to coordinate. But when the member countries are not agreeing or disagreeing, then the coordinator is going to have a very hard job. So, this is a kind of an innate problem, and I don't think that I can think, or anybody can think of an easy solution out. So, but the first thing is to raise funding. Maybe that's the minimum we can do, and then there's a lot of debate about whether a reform of WHO and things like that. So, as a scientist, I always say it's beyond my kind of pay level to go to there. It's just too complicated. Yeah.
Okay, you are a scientist. Let's take a look at the, where we are now with this new variant of Omicron.
Yeah.
We have BA.4, BA.5. Now people are talking about the BA.6. So, where are we now?
Yeah, so I think that this is something, I have been studying on coronavirus, for 20 years now. Even myself, I was in Wuhan in January 2020. I would have never predicted where we are now. I'm not talking WHO, I'm not talking about politics, I'm talking about the virus, okay? So this is one lesson. I used to work on the Hanjo Nipah paramyxoviruses, coronaviruses, you can say it's smarter, or the genetic genome, it's much more flexible. So I think, we're not gonna stop at BA.5. So I think the way out, really, there's only one way out, is develop better vaccines. We discussed already, Donald and others, about the vaccine can only current vaccine can only prevent really severe disease and death, but it cannot prevent infection. So that is the problem, because if you cannot prevent infection, then by vaccination, the large population in the world, inadvertently, unintentionally, you actually promote virus mutation. So this is where all the variants is going so rapidly, and it's clear it's under immune selection. So we're caught in between. It's a dilemma we're having, right? If you don't vaccinate, people will die. If you vaccinate the whole world population, but without prevent infection and the transmission, you speed up the virus mutation. So that, that's why I think, we all know, I mean, Tony Fauci already says, the vaccine currently lacks three things. One is that, it does not prevent infection. Secondly, is the breadth is not there. And thirdly, is the longevity, is not enough. So as a scientist, we're working very hard in all three areas. And hopefully, we will come up with a better vaccine and can prevent transmission, and then at least reduce the chance of mutation.
Mm-hmm. Well, Dennis, what can we do? What should we do? Say, are we on the way to herd immunity, or say, just live along with the virus, or we still continue to fight the virus by suppressing it, by eliminating it? What's the best? What's a good choice?
Well, there aren't any good choices, I think, right from the start. And I would agree with the last comment that until we have a vaccine that is fundamentally a transmission blocker, then we're going to be living in a state where we have to figure out how to minimize the health impact of the virus. When the pandemic began, we were at a tremendous disadvantage because we had no biomedical countermeasures. The only thing we could do was to impact on people's behaviors. So through lockdowns, promoting masks, personal hygiene, social distancing, the emergence of the vaccine. And if you remember, the vaccine against the first version of the virus was in fact a transmission blocker. But then the next variant, the first thing it did was adapted to allow it to successfully infect, and we've not caught up with the virus since then. So I would agree, we need to put a premium on developing a transmission blocking vaccine that is universal enough that it can adapt to whatever new variants come out in existence. But between now and then, as a global community, we're going to have to learn to live with this virus very much the way we've learned to live with influenzas. And that means we need to make sure people get vaccinated. We need to continue to promote what we know are behaviors that really limit exposure. And as such, they are the transmission blocking interventions that we have: masks, social distancing, et cetera. So we live we're in a very unsatisfactory space right now. We have a virus which causes serious illness, and we're still learning about the long-term effects of these infections. Mm-hmm. So we need to, again, have clarity about what vaccines do and don't do, what living with the virus means and what it doesn't mean. And in some way, we have to move from a position of trying to shut down communities every time the virus shows up towards figuring out how we can minimize the consequences of the virus by equitable and easy access to the countermeasures that we do have: vaccines, drugs, and again, masks. So for the next couple of years, we're going to be in a situation where we do not have a satisfactory answer.
May I make one comment here that I think this issue of how you get vaccine out to the whole world is also one of where the plans assume a lot of centralization, and decentralized production is going to be critical to that, just like it is to N95s. And so it has a lot to do with rethinking what globalization means and how it works. We need global cooperation and coordination, but we also need decentralized production and to have resiliency and rapid response capabilities. And on top of that, we need not to be relying only on vaccines, because no matter how good we get at making them, there will always be lags between the time when the virus is emerging and when there's a vaccine, whether it's 3 months, 6 months, 2 years. There's going to be an interval where we are vulnerable and we have to do other things. And that is an environmental intervention. We cannot rely just on masks. Masks are good, but they're far from perfect, and making everybody put on masks, including little children, is very difficult. And there is a lot we can do to contain these respiratory viruses by ventilating our indoor environments, by sanitizing the air, and not in our homes as well as, but especially in religious meeting houses, in stores, bars, and restaurants. We need to have all of these places such that they are not permissive for virus transmission. Mm-hmm. And we can do this, but it needs to have a global commitment, a global understanding of the problem, and a global commitment similar to what we're talking about for having vaccines.
Well, thank you. Zhiwei, the Chinese President Xi Jinping has called for the building of a global community of public health. So if you look forward, into the future, what we need to do, probably, what are your suggestions in order to have, to bring every country together, to work together, to have a better cooperation, coordination, to prevent any future pandemic somehow running out of control like this? What do we need to do?
Well, as Linfa mentions, the WHO probably still is the best platform for the international coordination. Although we do have different opinions, we do have arguments on a way of public health policies, and there are various different disagreements. But the WHO has the most broad reach in dealing with global issues. As we have seen in this pandemic, that without the WHO's coordination, the situation would be much, much worse. So I think it's very critical that, as Linfa mentions, that at least the WHO should be better funded and it would develop more effective programs and do preparations for this. The other thing is, I think that the wealthy countries should have develop a certain mechanism, build up a multinational mechanism to deal with the next pandemic. It's very critical that the government has certain commitment, and the scientific community could also do something by forming the global task force in dealing with any the early signs of a potential pandemic. By exchanging scientific communities information and by scholar exchange. I think those are very critical and very important. The other thing is, I think it's very important to have a global monitoring system and to have the earliest warning sign, see whether the pandemic, the next infection would come from. And then we would have sufficient time to prepare to deal with a new pathogen before it is spreading into a larger population and cause infections like the present situation.
Yeah, let's take a look at any questions or comments from our audience. The young lady from the last row, the second from the left. Yeah, yes, you're raising your hand. Go ahead, please.
Here is the link from Nanjing University. It's a great honor to participate in this academic forum, and thanks for all the experts for sharing. So since the beginning of 2020, COVID-19 has been keeping mutating these years. And for now, it's very obvious that we have to learn how to live along with this virus. So at the present, I don't think we can judge which country has the best defense measures. And no matter what kind of defense measures the countries are using, the whole world has the same goal, just to defend this epidemic. Therefore, for the next step, in I would like to ask, in what area you think we still have rooms for countries to cooperate globally against the epidemic? And is it possible to establish unified global anti-epidemic approach? Thanks.
Alice, go ahead.
Well, that's a great question. And I think what we need to do right now is make sure that we have a pan-coronavirus vaccine developed as soon as possible. I understand that there may be a little more than a dozen such vaccines in development right now. There's one being developed at the Walter Reed Army Institute of Research. That's kind of a front runner. And then another one at the University of Washington, which is about 30 minutes from where I am right now. They have one in development. But even those researchers are saying that these vaccines may not be ready to be injected into arms until 2023, 2024. But we can cooperate in terms of research and also in terms of production. So as I mentioned before, if we have a new vaccine product that we know will help the entire global community, we need to make sure that we have manufacturers in India, in South Korea, in Brazil, in South Africa, in Rwanda. We need to make sure that all over the world, people have access to the formulation and to the steps in terms of how to get these vaccines manufactured. And so I think that's something that we need to get ready right now, vaccine manufacturing capabilities around the world. And I will just say in what we were talking about before in terms of, will it be okay to just open up borders in China? I will say at one point during the Omicron wave, South Korea, it's a country of 52 million people, had the highest number of cases in the entire world. And it has not led right now to low death rates. And unfortunately, one of the saddest outcomes of that is we had an unacceptably high number of pediatric deaths during the Omicron wave. Pre-Omicron, there were only 3 pediatric fatalities in South Korea. Post-Omicron, it went above 40, and any number of child deaths is completely unacceptable. And so that's just something that I would perhaps keep in mind when considering whether or not to open up completely.
Mm-hmm. Well, thank you, Alice. Thank you all. Well, with that, we come to the end of today's discussion. Again, many thanks to our guests and our audience. You can also find us on the CGTN app or on YouTube. I'm Xu Qianduo. Thanks for being with us. See you next time.